All right, so we're gonna go over scans today with a big focus on how we use the scans for pregnancy care. Scans are one of the best and most key tools that we have for creating care plans for all of our patients. But during pregnancy, we look at a few different things. So we're just gonna go over all the scans general today, and then we're also gonna focus on what we look for the most in pregnancy care to determine the frequency of care during the pregnancy. So here we have our EMG scans. This is what a normal EMG looks like. So we have equal-ish bars on both sides, and they're gonna be white bars. Those are normal variations in muscle tone. They should be smaller at the top and at the bottom and wider in the middle, because we want more core activity than we want up top and at bottom. We want that core really supported for everybody, because that's what makes sure that the rest of our spinal nervous system is supported and healthy. And then over here, we have a reading for an EMG. We'll have some greens and blues, which are mild or moderate elevated differences in muscle tone. We'll have red, which is a severe difference in muscle tone. We can also have some yellows, which are underactive muscles, or muscles that are just not working efficiently. We'll also see the symmetry one, but we'll look at that one in a second. So over here, we can see how there is some wider activity in the core, but then very shut down lower into the lower back. So during pregnancy, it's very common to see these shifts in muscle tone to higher up in the neck, especially because we are trying to accommodate for the change in gravity. Gravity starts shifting as baby gets bigger, takes up more space, and we're constantly trying to find that balance between that forward shift from the weight from the belly and then trying to balance back out. Okay, so we can often see higher tone in the neck, lots of tension here for mamas. We want to take care of this as much as we can now, because later on, this is a very common one that can get aggravated or worsened with breastfeeding, carrying baby, bottle feeding, anything that has to do with the forward posture of holding baby. This we want to take care of now to have less impact when that happens after birth. And then lower in the core, we usually will see, it's very common to see more inactive core, or those yellow readings. We want to support this as much as possible, because a strong core is not only important for a comfortable pregnancy and for good posture during pregnancy, but it's also going to be crucial for labor and helping baby descend efficiently, and then for birth to help baby come out as well. So we want to make sure that we're supporting the core. Any inactivity, we want to build back up or activate so that those muscles are working efficiently. So this is just an overview of that first EMG. We'll also see some posture asymmetries in this scan. We can see if the posture is being affected more to one side. Like in this one, we have a lot of concentration of elevated muscle tone to that left side. And then we can see how the body is naturally trying to balance out by pulling towards that opposite side for this reading in the neck. Okay, and again, this one's just pointing us to, yes, overall in the spine, we have a lot of that imbalance towards that left side for this patient. And during pregnancy, we want as most balance as we can, especially in the pelvis, but everywhere overall. Balance in the pelvis is going to be crucial for comfort for mother, making sure baby has the best amount of space possible. That's what we do with Webster Care, and making sure that there's the best space for baby to descend and be born. So we're really going to work on balancing out this muscle tone symmetry for this mama, and then making sure that the body doesn't have to create these elevated tones to the opposite side to compensate for that. Let's go over the next scan. Over here, we have our thermal scan. So here we're gonna see the autonomic function. And autonomic function is just all of those automatic functions that our body and our brain has to do with. So our brain communicates with all of our organs, make sure that everything is functioning efficiently. And this scan here is just helping us see all those automatic functions and that our brain controls. So our brain controls, our heartbeat, digestion, making sure that we're breathing appropriately. So all of the automatic organ functions are controlled by the brain, and we can see with this scan if any of them are struggling or having to overwork or have become irritated because of a lack of appropriate communication between the brain and the body to those areas, okay? So here we can have blues and greens as mild and moderate differences in temperature. We can have white, which is normal variations of temperature, and we could also have red, which are severe increases in temperature. Here we can see for this mama, we have higher signatures of temperature in this mid area in the back. So we have more, or we're working into those adrenals. We want to make sure that the adrenals are not stressed out more than they should be. You know, there's always a lot of stresses during pregnancy, and the adrenals are a big factor into managing that stress. So we want to make sure to support this however we can for them. And then over here, we have our HRV. So during pregnancy care, we focus a lot on what the HRV is telling us, because this is what's really going to tell us how much energy reserve or neurological reserve we have going into birth, okay? And we want to make sure to build this up and make sure that this one looks as best as it can, especially for birth, because the more we support this scan, the better birth can go and the less effect it'll have on mom for postpartum care. So when we're reading the HRV, which is heart rate variability, we're gonna have this line down the middle, okay? This is gonna separate our parasympathetic gas pedal. And on this side, we're gonna have our parasympathetic, I don't know if I said that right or not, cut. Shoot. So I'm gonna start over for the HRV. So over here, we have our HRV. So this one is one that we specifically take care of going through the most when we're taking into account a pregnancy care plan, okay? So when we're looking at recommendations for this one, it's really gonna tell us how much depth we have to put into it to make sure that mom has the best reserve possible for birth, because birth can be pretty stressful, and this is where it'll show the most, okay? So we have our HRV right here, or heart rate variability scan. We have this line that goes straight down the middle, and it separates between our sympathetic on this side, which is our gas pedal, and then our parasympathetic on the other side, which is the brake pedal. Okay, when we are in a state of balance, or we're within on top of this middle line right here, sympathetics is action, which is needed to make sure that we're doing things appropriately and responding when we need to. And parasympathetic is just rest and digest. When we're outside of balance, or we're farther away one side or the other, if we're over here or over here, away from that midline, sympathetics become fight or flight, or chronic stress. And when we're over here way too far into that parasympathetic, brake pedal, rest, digest can become exhaustion. So we're really paying attention on where our moms or anybody can plot on this scan. So here, this white circle is our patient's reading. So for them, we see how they're significantly farther away from that midline, all the way over here, and then into that sympathetic gas pedal, okay? The further down we get, the farther we are from having a good neurological reserve. So think of these colors, the green, the yellow, orange, and red, as your battery life. The better we are in the green, the more battery life we have. Further down into the yellow, orange, or darker red is less battery life, okay? So just less neurological or energy reserve, okay? So we have this person right here that is in this orange, so very low. For them, it got into a 50% for autonomic activity index. So that's about half of the energy reserve that we should have. And then farther into that sympathetic side. So for this person, they're not only in a tired phase where they're losing energy and they're having a really hard time charging back up, but they're also in that chronic stress situation on this side, okay? So we see them over here, and it's just that lower reserve for them, okay? When we're planning for a pregnancy, we want to make sure to build this up as much as we can. So a 50% autonomic activity index is very low. We want to build that up as much as we can towards that green, because that's what's going to have big impact in pregnancy, the rest of the pregnancy, for the birth, and then especially for us for postpartum care, okay? During birth, regardless of how birth goes, if it goes perfectly exactly how we want it to, if it's completely peaceful, if it's more of a stressful birth, all births will always deplete our reserves in this scan some, right? Birth is very stressful, it is very tiring. So regardless of however it goes, birth will always deplete us in this scan, okay, after birth. So when we're coming here and we are maybe in the beginning of the pregnancy or in the middle of the pregnancy and we're low here, we want to make sure to build it up as much as we can towards that green, so that when we do dip in from the energy reserve after birth, it is not as big of a fall, right? So if we're over here and we start off there and birth will dip us all the way here, it's less of an energy downer than if we were already where this patient is right here and kept dipping further down, okay? So that is why it's so important for us to build this up as much as we can before pregnancy and birth. Overall, we look at these scans together, so we see if we have any trends with them, like any specific areas. Like for this person, we have big trends into this middle back, both scans. So for the autonomic scan and the muscle tone scan, so we know that in the mid back, we're gonna focus a lot, especially because that's an area that can really be affected from changes in posture. So we just look at all the scans individually and then together to create the best plan possible for each parent and each mom.